Dr. Fauci, thank you so very much for joining us today. Actually, I think most of us who are on the seminar today we're seeing you testifying in front of Congress earlier today, and so I just think you have amazing stamina to be able to go from that and then very graciously join us here today. So let me just start off by saying thank you so much. As president of the National Hispanic Caucus of State Legislators, I'm very grateful. We all are that you are here to join us today.
My pleasure. Good to be with you.
And so let me just start off with my next guest needs no introduction. This is, I think, at the moment, the most known person, if not one of the most popular people in America right now, and but it's because of the content that he has and the work that he's been doing. And so, Dr. Fauci, this pandemic has been particularly devastating for many of us because who are here today, because we represent constituencies with already notable health disparities due to the social determinants of health. And one of the things as we look at the impacts of COVID and trying to find a solution is that Hispanics already have the highest relative infection rate of any race or ethnicity in the United States. And it's 79% higher than our population rate. And according to an independent research group, the age-adjusted COVID-19 death rate is 2.5 times higher for Latinos than for non-Hispanic whites. All minority groups have higher levels, and of course, Native Americans, even and African Americans, even higher than us. But as we take a look at these health disparity issues, and as well as consider who's considered to be an essential worker, which many of us are, for the jobs that we do supporting everybody else in society, what should we expect regarding upcoming milestones in the treatment, as well as vaccine development? And is there anything we should be on the lookout for, sir?
Yeah, well, thank you. You're absolutely correct in everything you say about, I refer to it as kind of the double whammy of the minority communities, including and particularly Latinx and obviously African Americans. The double whammy is because of the nature of the jobs that as a demographic group has, you have more of a chance of getting infected. And when you do get infected, you have more of a chance of having a serious outcome, which you correctly said is the social determinants of health that give you a higher degree of, name it, all of the above: hypertension, heart disease, obesity, diabetes, et cetera, et cetera. So those are the things that really are an issue. So what can you expect in direct answer to your question, Senator? What you need to expect is that we have now a couple of drugs that are good for people with advanced disease. The dexamethasone for people on ventilators and people requiring oxygen, remdesivir for people who have hospitalization, not ventilators, but people who require oxygen. What we really need, and what we actually have started 2 studies literally this week, has been to try and get early interventions, early therapy for people who are not yet seriously ill, to prevent them from having to go to the hospital. One of them is monoclonal antibodies, which are, proteins that you can clone out from people who've been infected or people who've been vaccinated and have a good immune response and passively transfer it in. I would think that in clinical trials, because I think that clinical trials, whoops, that's my wife's dog, hold on.
He's a human too. He's a real person.
I came home rather than go back to the NIH, because if I drove all the way from the hearing to NIH, I would have missed this. So my house is between the NIH and the hearing. So that's why I'm here. So these are clinical trials that I would encourage your constituencies to get involved in, because it would give them, the opportunity to get what I think is going to be a pretty good therapy for early disease. There's a whole bunch of other clinical trials that are coming, but the clinical trials for monoclonal antibody, I think, are going to be a big plus in the armamentarium. Vaccines you already know about. And, this is one that I think you may do a service to your community is that there are a number of vaccine trials that are already in phase 3 trial. One that went into phase 3 trial on Monday. It's the Moderna messenger RNA trial that's going to enroll easily 30,000 people to determine if it's effective. I like what I see in the early studies, that the induction of antibody in the phase 1 study gave antibody levels that were at least comparable to and likely better than the antibodies that you get when you get natural infection, which is really a good sign. So we're doing this big study, and for 2 reasons, we want to make sure that the Latinx community are properly represented in the trials, because we need to know, I think it's going to be no different, but we need to prove that it is effective and safe in the Latinx community, as opposed to getting an all-white trial and make an assumption that it's safe and effective in the Latinx community. And I know there is, in many respects, in some segments of society, an anti-vaccine feeling, the anti-vaxxers. We've got to be able to get over that. And I think it would be so much easier for people who are in the community and trusted by the community to get out there and try and get people to enroll in trials.
So Dr. Fauci, as we're talking about that, one of the things about the time frame that we're looking at, which on the one hand is very impressive in terms of what we're doing. On the other hand, there's what I've heard from a lot of people who aren't even in the anti-vaxxer community is simply a concern of the speed with which we're moving.
Yeah.
And so how do we balance that with safety, both for the people in the trials as well as after the trials when we gear up and start offering vaccines?
That's a great question. It's the relevant question, is because first of all, the overarching government group that is involved in this assumed what I think is an unfortunate name, Operation Warp Speed. I didn't like that from the beginning, because to me, it almost reeks of reckless speed as opposed to, speed that is measured. The truncation of time, Senator, I can tell you has nothing to do with compromising safety and nothing to do with compromising scientific integrity. Let me give you an example. So from the time you get the sequence of a virus or grow it in standard vaccine world, it takes about a year to go from the time you get the identification of the pathogen to the time you start a phase 1 trial. And a phase 1 trial is a small trial, 50 to 100 people to determine safety. We got the sequence, and because of the technologies that we have today that we didn't have 10, 15 years ago, within 4 days, we were able to get it and start making the vaccine. Within 62 days, we were in a phase 1 trial. So we went from, instead of requiring a year and a half, we did it in 2 months. So right away, we saved an entire year and 4 months.
Wow.
And that has nothing to do with safety. We haven't done anything on the patient yet. It's just getting the product. Then when we went to the phase 1 trial, we started investing money in preparing our sites for a phase 3 trial. So instead of waiting for the end of the phase 1 trial, we invested money. So the risk was money. The risk wasn't safety. So we did that all along. So right now, that's the reason why I can say that we're in a phase 3 trial in a product that passed the first and the second safety profile. Now we're going to do a big trial, looking at not only efficacy, but carefully looking at safety. And when we see anything that's strange in safety, we're going to call a timeout right away. So that's the point. Okay. So it's understandable how people think, wow, you're going so fast. You must be skipping over safety roadblocks and checkpoints, and we're not. But
So,
it's a very understandable concern.
well, and of course we're policymakers at the state level, right? The federal government has the opportunity to ramp up quickly, to allocate resources, and at the state level, a lot of us are in states that are struggling for resources as we're trying to move forward and address the pandemic. What are the benchmarks we should be looking at in terms of confidence on where things are with the vaccine, and assuming everything goes well, the big assumption, but assuming everything goes well, when more or less are we looking at in terms of being able to roll out vaccinations, and after we do that, what's the time frame before we will actually start to see a difference on the ground?
Okay, so conservatively, some people want to do it sooner, but I'm not sure it's going to be that way. By the end of this calendar year, by November or December, we should have the answer as to whether or not we have a safe and effective vaccine. The FDA has promised that they will scrutinize that very carefully to make sure that they don't put out a vaccine. Because, see, I do the science and collect the scientific data. They make the regulatory decisions.
Right.
I've been assured that they will make it purely on the basis of the scientific data. So I would say somewhere around November, December. If there are many infections and the trial happens to be physically located in those areas where there's a lot of infections, you can get an answer sooner. You may get an answer in October. It's possible. So, having said that, by the end of the year and the beginning of January, there should be doses, not in the hundreds of millions, but in the tens of millions. As we go into 2021, the company promises us that they would have a couple of 100 million doses as we get well into 2021. When you get to that point, what you would have is enough doses to essentially distribute it to everybody and anybody. In the first month or two, what would happen is that there would have to be a prioritization. And the prioritization is going to be determined by the advisory committee to immunization practices that advises the CDC and a special group that we put together with the National Academy of Medicine to add an extra degree of impartiality and ethical concern about who should get it first. I would think if things work the way they usually work about prioritization, you would go with healthcare providers who are in danger every day of getting infected. They need to get it first. Then after that, the people who are most vulnerable and have the greater chance of a poor outcome. And that would include the elderly and people with underlying conditions. And I would think, given the high level of underlying conditions in the minority community, that we should probably see that as a prioritization. I can't guarantee that,
Sure.
but that's what I think is going to happen.
So I have a 6-year-old daughter who is supposed to be starting the first grade in a couple weeks. And Olivia wanted me to make sure to ask you, what do you see as the time frame for schools?
Okay. So it depends. That's a great question. As a default position, we should try to open up the schools for a number of reasons. It's good for the psychological aspect for the kids. In some regions of the country, in some sections, in some county cities, school is a source, importantly, for the food and nutrition of the children. Breakfast at school, lunches at school. I know that my daughter is a school teacher, so I know that. That the next thing is that the secondary, downstream, unintended ripple effect negative consequences beyond the children for the mothers and fathers who are working families that would then get disrupted if the kids are at school. So you should try to get the children back to school. Then I write in capital letters, however, it should always be the first priority is the safety, the health, and the welfare of the children, the teachers, and secondarily to the parents who could either get infected when the children get infected. So we live in a big country. And there are certain parts of the country where the level of infection is so low, you don't even have to worry. You can do anything with impunity. The kids are going to be fine. But there are certain sections of the country where there's enough infection that the people who are the superintendents and the principals might locally decide they want to do something different. They want to either have alternating classes, a hybrid, part online, part physically, morning, afternoon, alternating days, wear masks. There are other parts of the country where the infections are so high, the hot zones, the red states, where they're really red being red bad, not red blue, but red, yellow, green.
You're talking red pandemic, not red.
Yeah, right. That there's so much infection that they may decide it's just not prudent to get the kids back to school. And I think we need to be flexible. So depending upon where you are, Senator, and what the level of infection is, will determine whether the school should actually open completely, open partially, or time out and wait.
So now, when you say should open or time out and wait, are you saying should open even while we're waiting for the vaccine trials to finish up?
Yes, yes. I think there will be sections of the country where the level of infection is so low that they could go and you wouldn't need to do anything. But there will be sections that if you decide you want to open, you've got to make sure the children are protected. You've got to be able to have the public health practices in place that would protect the children. Now, if in fact it's so much infection, then anyone with good judgment would say it's a good idea to just do it all virtually or not at all.
Right. But those are the hot spots. But other than the hot spots, you're saying really in terms of the small children particularly, get them back to school, if at all possible.
Yes, but you got to make sure that in that school, the optimal public health practices are being implemented. You can't just throw them back. You've got to say, what's the level? Here's what we got to do. We may need to have morning classes for some, afternoon classes for others. We got to clean the classroom after each change of shift. We got to make sure the teachers are well protected themselves. They should be wearing, I don't want to be giving you chapter and verse here.
No, I understand.
Locally, the principals and the superintendents should know that. If they have any doubt, the CDC has guidelines about how to open safely. But the only thing that I say is that you got to be flexible. You can't be making decisions for the whole country based on one criteria, because the whole country is different. There are some parts of the country that are very different than others when it comes to the level of infection in your community.
Certainly, no. This is very good because it encourages that conversation to take place, and for us to know how to engage on some of these issues. Let me ask you a question that may or may not be in your wheelhouse, but since you were on Capitol Hill today, you've been asked a number of questions that weren't in your wheelhouse as you were proceeding, and that is, as we're able to roll out the vaccines, there's a lot of people who are very concerned about the cost of the vaccinations, as well as the people who are either uninsured or underinsured as to how they may be able to access the vaccinations. Are you able to comment on plans that may be in place for that or not?
Yeah, I can tell you now that at the level of the people who are in charge of Operation Warp Speed, they are negotiating with the companies as to what the price of the vaccine is, because we, the federal government, are going to buy the vaccines, and hopefully we'll be able to get it to the people who need it, without cost. In other words, no one who needs to be vaccinated, who wants to be vaccinated, should not get vaccinated because they can't afford it. I mean, to me, that's a fundamental default principle.
Okay. Well, no, and it's certainly, given the impact that this particular pandemic is having on the entire nation, it does seem to make sense that it is a national priority. I don't know if I would say necessarily responsibility, but you're right. But certainly it would be a national priority to make sure that we get all of these vaccinations out to people and make sure that people are able to get vaccinated.
Right. Yeah. I totally agree with you. I don't control that, but I can tell you to the extent that my voice is listened to, and I'm not shy about making my voice not listened to, that I'm going to really push for what you're talking about. There should be no one who just can't get vaccinated because they can't afford it. I mean, that's crazy.
That's fantastic. And by the way, I'm looking at other faces of people who are applauding and holding up a supportive fist at this point as you're saying that. So, we appreciate your voice very much on this. Let me ask you in terms of, you addressed this a little bit at the beginning, and that is the issue of making sure that the clinical trials that happen with a diversity of participants and whatnot. A, what is it that we can do, and B, I did think it was the fact that some of the trials are taking place in I think the Atlanta area is my understanding, and there's some other places where there tends to be more diversity than other parts of the country. Is a good sign for that. But what is it that we can do, A, to be watching out to make sure that happens, and to be supporting this process?
Well, yes. So it's interesting. What I think the most important thing you could do is to mobilize your community to go out and participate in the trial. There are 89 sites in the country. So if you go to, I want to make sure I got it right because I blew it at the hearing. I think I gave the wrong website. But it's coronaviruspreventionnetwork.org. Go to that and you click around in that website, and they have a map of where all of the vaccine trial sites are. So you can see where you're located, where it is. And if there's a site there, that means they're accruing patients, volunteers. So what you can do is encourage your people who are your constituents to register for those trials. Go to the map and take a look at where you are on that.
And we will make sure that we get that website, push it out to all the participants, and we will also tweet it out and make sure that it's on our website as well, a link to that, so that we can.
Hold on one second.
Go ahead. I think the dog needs to be let out.
It appears that one did not work. Senator Rivera just checked it.
Is it working?
Go ahead.
Give it again, sir, if you could.
Were you able to access it?
We were not able to access it. We might need to, if you have it there, but.
Okay, wait a minute, time out.
No problem, take your time.
Coronaviruspreventionnetwork.org. No dots, no dashes, except for the dot before the org.
Got it.
Coronaviruspreventionnetwork.org.
And we're already seeing it on the chat, so we have the correct. Thank you, Dr. Fauci, for that.
Okay, and if you go there and you go through the different things, you'll see the map. And the map is where these sites are.
Okay, fantastic. We will be doing that, and so you deal, of course, with pathogens and infections and the impact on the human body. One of the things that I think we're going to have to dealing with at the state level is the behavioral health consequences of what's happened with this pandemic. Right. And that is one of the things that I think we're all going to be needing to be very cognizant about in terms of the impacts that this has had on a lot of people who have had to isolate, people for whom isolation was not a healthy thing, as they are protecting their bodies, that it has had an impact upon their health. Right. And so, I don't, do you have, I don't know if you have any commentary about that. We're all doing, I think, what as best we can to follow the best advice and do what we need to do to slow down the viral spread, if that's properly stated, of the pandemic. But at the same time, we recognize there are other impacts as well.
Okay. Yes, but you know, one of the things, at least before we run out of time, I want to make sure that I get the message across, is that, you know, there are red states, which means they have a greater than 10% of the population is positive. You have the green states, which have less than 5%, and you have the yellow states between 5 and 10%. One of the things that we've noticed is that in the states that look like things are fine, who are not paying attention to that, as the percentage goes up a little bit, we get on the call with the governors, and the governors say, oh no, everything's fine, our state looks good, we're in good shape. But it's very insidious, because as it goes up from a fraction of a percent of the percent of tests that you do that are positive, that's a warning that's a prediction that you're going to have a surge. So there are 5 things that we recommend, and I've been really pushing this, and you may have heard me if you were watching the hearing. I've said it about 2 or 3 times, that everybody should do. Universal wearing of masks, avoiding crowded places, particularly indoor crowded places. Number 3, keep a safe distance, 6 feet or more from people if you could possibly do that. Bars, either stay away from bars, or if you have any authority, close the bars. I know people get very upset about that, but bars and people hanging over bars, give me a refill, etc., that's how people get infected. And 5, washing hands frequently. They seem like non-rocket science, simple things, but it's amazing in those places that have done that, they've either turned around the surge or prevented the surge from coming. So if you can use the bully pulpit of your office as elected officials, if you can get that message across, that what happens now is going to be reflected 2 weeks from now. And what happened 2 weeks ago, you're seeing now. So if you want to make sure 2 weeks from now, you don't see a surge up, do the things I'm talking about now.
No, that is fantastic advice, and thank you very much. Dr. Fauci, we don't want to abuse your time. We appreciate so much that you've been willing to join us here today and join into this conversation. This is really the issue of our time. This is again, as the father of a 6-year-old, this is what she will remember about her childhood,
Right.
the rest of her life. And in many cases, what will be shaping people. So thank you so much for your dedication, your service, all the amazing work that you have done, and we look forward to continuing at some point a conversation with you, if at all possible. But we're just overjoyed that you were able to be here with us. I will tell you also, as we're wrapping up, that given the time frame, I wasn't able to get it done in advance. But there is a lady. I'm in New Mexico. There's a lady up in northern New Mexico, and we're checking with the ethics rules to make sure that this will work. It's a de minimis amount that is involved here, but she is making retablos of Saint Fauci, and so I am trying to acquire one of these. So that we can send one to you as a thank you from the National Hispanic Caucus of state legislators, and that you can appreciate the immense gratitude that we all collectively have for the work that you have done.
Thank you very much, Senator. I appreciate it. Thank you all. It was a pleasure being with you. And as you said, I'd be happy at an appropriate time to return as we get further into things as the summer and the fall comes in. Thank you very much.
Thank you,
Take
sir.
care. Good to be with you.